thank you very much to the panelists, both from the public health community as well as the medical students. Thank you, sir, for hosting and moderating that discussion. There are a few comments in the chat box. I'm not sure whether I should direct it to you. We could take about 5 minutes. There's one question asking, why are we not using a horizontal approach to deal with this pandemic? Different states are facing different issues, and a population-based approach for prevention. We still seem to be more focused on curative care.
Well, basically, if by horizontal approach you mean that each state should be able to take its own decision rather being guided entirely by central policies or diktat, I would agree with you. Certainly in the face of a new pandemic, particularly when flights are coming in from outside, bringing in potentially virus-infected persons, there has to be a national policy that has to set in motion. And the response has to be organized at the national level through center-state consultations. But as the epidemic advances, certainly you need to actually move to the state level and then into the district or even the sub-district level, where the decisions will have to be made on data collected and analyzed as close to the field as possible. So having policies made at the central level, planning at the state capital level, but execution or implementation at the district level, or even actually at the ward and village level would be the ideal way to go. And even if we had begun with a slightly top-down approach, this is the time for us to decentralize. Decentralization with coordination and consultation.
Thank you, sir. There was one other comment on, do you think the trust in a globalized world will reduce or has reduced post-pandemic? I mean, that's more a comment, but if anyone just wants to respond to that, more as perspectives from the youth too.
Yeah, I think it's the young people who should respond because they're going to be actually living in the world longer than we are. So they must
I'll put that
their
out
perspective.
to you. Yes, yes, sir. So Purva or Sai Krishna, Vishal, does anybody want to respond to that?
I can attempt to take this one.
Yeah.
Now, in terms of, and this is me providing my perspective on this question. In terms of trust in a globalized world, it will be a yes and no both. Considering that we have seen certain failures in globalization, especially amidst this pandemic. But we've also at the same time seen opportunities of collaboration, cross-country collaborations, and one country cannot have all resources that it needs to sustain human life. It may be at the basics, yes, but if you were to talk about rapid development and growth of the country, it's always, I mean, there's always more scope for it when it's being done with bilateral or multilateral exchanges with other parts of the world. This pandemic has also taught us that we have strengths and we have weaknesses when it comes to talking about globalization as a whole. I mean, it's a very big term to directly just say yes or no. But I think we've highlighted what works and what doesn't work. So maybe in terms of what doesn't work in this globalization era, are opportunities for us to fix them as leaders of the future, because we have seen what has failed potentially, especially in terms of the lives lost, mistakes, the cost of the mistakes that we made just while being the most globalized version of the world we've ever seen. And also to capitalize on the good that's come out of it, to capitalize on the learning experiences that have been shared, also to capitalize on just how much has come out of collaborating on both humanitarian basis as well as on more business and non-humanitarian basis as well.
Well said.
Yeah, I agree. Very well said, Purva. So, so 1 minute left on this panel. So would you, the public health representatives, want to add from your perspective?
Yeah, hi, ma'am. So I would like to take this. So, at the risk of delving into real politics and geopolitics, I would like to say that we are already part of a very, very multipolar world with uh, a very nice gentleman taking the helms of the United States, and China kind of dominating the entire global scene. What I feel is that with the coronavirus spreading and the world becoming more insular, we might look at a major shift in geopolitics, in the sense that globalization might not crumble entirely, but at some level it might morph into something more localized, as if say one country in a specific region might become more prominent or more powerful, and that might be it. Like, not many countries might have the resources or honestly the geopolitical strength to exert themselves internationally as they once could. Globalization basically ran on the power of Bretton Woods, which was instituted when a post-war America took helms of the entire world and faced off with the Soviet Union. The days of the superpowers are gone. Even China, the world's financier, is being looked up as some sort of a culprit in this entire situation. Definitely, the trust in globalization will wane. Definitely, it will wane. But we have to realize that we cannot just do away with an interconnected world. That's just how humankind works. We need each other. So that's my 2 cents on it. Thank you.
So any closing thoughts?
No, I think these are stimulating thoughts. Some of the thoughts could actually be subjects of a debate, but I believe that we will require global solidarity to face common global threats. But even in that environment, we need to be fairly self-reliant as much as possible. You cannot be euphoric about globalization and depend entirely on imports of essential goods, whether it's medicines or other elements. So I think we bring a better balance into our understanding of globalization. A Portuguese writer called Miguel Tardo said, universal is local without the walls. So a lot of action will have to be local, but we have to break down the walls so that knowledge can flow freely and global solidarity can assert itself when there are common global threats.
Thank you so much, sir, for summarizing that. And I'm really thankful to all these representatives from the student community, both from the medical field as well as from our public health institutes. It's really refreshing to be on a webinar like this and hear from younger voices. I mean, we've been flooded with webinars where we're hearing from expert professionals. So we were really excited to host this one with all of you. So thank you so much for coming here onto this platform and sharing your thoughts on this platform. Thank you so much, sir, for hosting and moderating this discussion.
It's a pleasure.
Thank you. So we do have a lot of comments in the chat box. I think we can share it with some of with the Medical Students Association as well as the Public Health Institute. Lots of thoughts out there to share with the youth on this platform. So we move. Let me move us on to the second panel. Again, just like in the first, we have 2 students from medical community, as 2 from the Public Health Institutes. The 2 representatives from the Indian Institutes of Public Health, Delhi, Jyotsna and Aishwarya. And from the Medical Students Association of India, we have Mauli and I think Salman Khan. So I'll hand over now to the moderator of panel 2, Dr. A.K. Shivkumar. Himself a New Delhi-based development economist, policy advisor and evaluator. He's a visiting professor of economics and public policy at the Indian School of Business, in the Young India Fellows Program at Ashoka University and at Harvard's Kennedy School of Government. So Dr. Shivkumar is going to be leading the panel 2, which is got the theme, Reclaiming the Environment, What Can the Student Community Do? Over to you, Dr. Shivkumar, to address the youth in this panel.
Thank you very much. And it's a great pleasure to meet all of you and have this interaction. Like Dr. Srinath Reddy was saying, it's very important for us to listen to the voices of young people, because when you talk about either health or environment, these are all long-term dimensions of human life that we need to address. So we saw in the first panel a whole conversation on health and COVID and the impacts and what we need to do. But in this session, as an economist, I would also like to bring out the fact that in addition to the massive health crisis, there is also an economic collapse. And inbuilt in that collapse, you will find are manifestations of extreme forms of inequality and injustice. And I think as a medical community and as a public health community, it is important for all of you to engage with these societal concerns of equity, justice, and fairness. So now if you juxtapose on what is happening in terms of the threats to lives and livelihoods, what climate change brings to as a third dimension, it is completely scary. I mean, it's so uncertain. It's so uncertain because the manifestations of climate change we are seeing in extreme weather conditions, higher intensity of cyclones, and now also the locust attack and so on and so forth, which has very serious consequences for people. And in fact, when you look at the human impacts of climate change, it actually operates quite a bit through the health impact. So from that point of view, I want to start by posing a question, which is, we're looking at reclaiming the environment and what the student community can do, keeping in mind both the health aspects, the environmental aspects, and the social dimensions of human lives. Let me start by addressing this question to Jyotsna Bedi. Jyotsna is a second-year student with the Institute of Public Health in Delhi. And Jyotsna, I'd like to start by asking you to share your thoughts on the impact of COVID-19 on our environment. What is good about it, what is bad, and what is ugly about this?
Hello everyone. Thank you, sir, for the question. So what's good about COVID-19 impact? We have seen a lockdown, a huge lockdown all over around the world, and we saw that there has been, a clarity of vision of air. Like there's an air quality improvement. There has been improvement with the wildlife. There has been improvement in water quality. We have news that Venice River is clearer now. We had a news that Ganga is clearer now. We had news that Mount Everest is visible from Bihar, and lots of such things that wildlife. We actually, when I get up in the morning, I can literally hear birds chirping. I mean that sound. My father tells me that this sound I haven't heard since 20 years or more, and this is now I'm hearing this, and this is a very big benefit. But and we have been let's come to the bad and ugly part, because that's more important, and because we have been bragging about the good part a lot, but what's about the ugly part? Number one, that the material that is being used for logistics for COVID-19, masks, PPEs, what is that material made up of? Most of that material is made up of single-use plastics. Single-use plastics are one of the most hazardous things that we have for our environment. And if and this way and India right now is producing that in tons, and that is very, very crucial now. Second, uh, there was a news that came from Africa. I recently read that there has been a bushmeat hunting there, and this is because the localites are doing it because bushmeat because there has been a reduction in tourism because of the lockdown, and there has been no tourism. They need their livelihood, so they are hampering the environment. They are hampering wildlife. So now, what's the ugly part? Ugly part is that all this is a very alarming situation. How? Climate change itself is a slow pandemic. We last 55 days, Delhi NCR region has seen six earthquakes. We have seen two big cyclones, Amphan and Nisarg. And on top of that, COVID-19 situation. What is COVID-19? COVID-19 itself is an environmental problem. How? COVID-19 itself is an environmental problem because obviously what is climate change? Climate change is humans hampering the environment, humans hampering the natural resources and get coming out, and these are the resources and overusing the resources. So that the increase, there is a increase in the burden of resources. So now what is COVID, what how is COVID-19 connected with environment? Obviously somebody has used somebody has got exposed to the pathogens in the environment. They have hampered the environment, they have hampered the creatures in the environment and got exposed to the pathogens. This is how COVID-19 came in. So and pandemics like SARS, MERS, so all these pandemics are a part of environment. So obviously this is a very alarming situation for us, that we already have a pandemic situation, that is a climate change situation, and on top of that we encounter a pandemic situation, that is a COVID-19 situation, that is a situation related to viruses. So if all these increase, then how are we going to deal with this? This is the ugly part. This is what we need to focus on. That how are we going to increase this? How are we going to deal with this in the future? How are we going to actually emphasize that what are the strategies we are going to follow? And on top of that, our economy is going down. We don't have good economies. Almost all countries. We spoke about globalization lagging down, right? We spoke about globalization has, like, it's gone, and China itself, China, the biggest global power, is going down. So what is all this economy? And if the economy is going down, then there is a direct impact on our SGDs, because we'll encounter more poverty. We'll Governments won't be able to invest in SDGs like water and sanitation, food for all. There are a lot of sustainable development goals that need a lot of economy in them. We lack in that also. So how are we going to deal this? This is an alarming situation, and this is the ugly part. We have bragged a lot about the good part, but we need to focus on the ugly part, that how this arise and what are we going to do for the SDGs now. Thank you.
John Mike. Yeah. Thank you, Jyotsna. That was very powerful and very clear articulation of the good, bad, and the ugly. Let me pose the same question to Salman Khan, who is a third-year medical student at Grant Medical College and the associated JJ Hospital in Mumbai. He's also serving currently as the National Officer on Public Health at MSAI. So Salman, let's hear from you what you think are the good, the bad, and the ugly of the impact of COVID on our environment.
Thank you so much for your question, sir. And I hope everyone is doing fine during the pandemic. I can't enable my video right now because I'm experiencing some connectivity issues. So I would like to start off by shedding light upon the good impact by COVID-19 on our environment. Pollution and greenhouse gas emissions have fallen across continents as countries try to contain the spread of novel coronavirus currently. For instance, Delhi is notorious for its deteriorating air quality index, and it witnessed improvement in the initial weeks following the nationwide lockdown. Its average air quality index was around 128, which has been the cleanest March since the last 5 years for Delhi. The air data quality, which was compiled by the Central Pollution Control Board on 1st of April, showed that there was an improvement in the air quality across 99 cities and towns in our nation. It's a very positive thing. However, we are not really certain if this is just a fleeting change or it could lead to long-lasting falls in emissions in the future. Coming to the bad impact, we all know we began a year with the Australian bushfires, and now we are in the middle of the pandemic. Initially, there was a worldwide movement for climate change and planet advocacy. We at MSAI also continue to reach out to the general population and spread the message of planet advocacy through our on-ground events. However, the SARS-CoV-2 outbreak kind of overshadowed all the pre-existing issues in the world, and the movement got diluted. As a result, climate change has taken a backseat in everyone's minds, and the pandemic continues to be the biggest challenge at hand. People have failed to realize that the detrimental effects of climate change are still there in the similar magnitude. Moreover, natural disasters like, for example, the cyclone Amphan caused not only extensive damage to the Sundarbans, but also made things really complex for us to handle during the situation. As we are celebrating World Environment Day today, an uninvited problem that could make things way too uglier for our environment is the issue of the disposal of masks and gloves. Uh, According to a recent report by Worldwide Fund for Nature, the report said if 1% of the masks were disposed of incorrectly and dispersed in nature, this was result this would result in as many as say 10 million masks per month polluting the environment. And if we consider the weight of each mask around 4 grams, that would result in a dispersion of more than 40,000 kilograms of plastic in nature. That was mentioned in the report. To summarize the points that I elaborated, it's time for all of us to realize that climate change will see no race, no practice of faith or gender while inching towards ravaging human civilizations. So, at the end, it's everyone's collective responsibility to preserve our planet for themselves and the future generations of flora, fauna, and of course, us humans. And that's all I wanted to say.
Thank you, Salman. I think both of you have brought out the the positive side of what is happening with the COVID-19 in terms of the changes that we see in the environment. The challenge, of course, is to see how we maintain this, because given how easily we should say Indians or Delhiwalas in particular slip into the traditional routes, it won't be too long, I feel, before they all get in. So the challenge really for you as young people is to also think about what you can do to use this as the launching platform for really planning some kind of an environmental movement in Delhi itself. Okay, let's move to the second question, and the second question is actually, I mean, I sort of touched on it, and it says, what is the role that you see for the student community in building back better in the post-COVID era? And this is where we really want you to tell us, as young people, given the complex governance structures, the political administration, the bureaucracy that we have to navigate decisions through, how do you really see the student community rising to the challenge of building back better in the post-COVID era? And this time, let me start with Mauli Mehta, who's a final year MBBS student. She's studying at GNERS Medical College in Ahmedabad and is also the Vice President for External Affairs at MSAI. So over to you, Molly.
Thank you so much, sir. Firstly, I would like to start by saying a very happy World Environment Day to all of you and to all our attendees. Thank you so much for your question again. And with respect to what our student community can do in terms of building back better, firstly, the post-pandemic era will surely be a challenge because as all of us are quite aware that the COVID virus is not going to go anytime soon. And one of the major one of the major risks which will be in exposure to that will be the fraternity of medical students, and how we are planning to like come back better is mainly through reaching out to local communities, because to be very honest, the entire time of the pandemic made us realize the importance of healthcare and the importance of reaching out to local communities, and that is one of the most important that is the essence of what we also do at the Medical Students Association of India, by conducting on-ground events with local communities, with medical students, with the general population. We try to reach out to we try to reach out to them and make them aware about the awareness issues which are going on, and like on different focus areas. So that is one thing which we will very solidly come and work on. And also the second part of this covers medical students in terms of how we can build their capacity uh, to make them better future healthcare professionals. And also in building their capacity with respect to making them understand the link between climate change and uh, the link between climate change and health. And how we plan to do that is through conducting online trainings and on ground trainings and on ground sessions for them. Sorry, my bad. And that's how we plan to come ahead and build capacity, for all the medical students who are a part of our community, who are a part of MSAI. And to just add, 2020 is a very important year for us to work on climate change and to build our capacity in terms of advocacy. And I'm sure that once we've already started the transition of going into a post pandemic era. So we are in a phase of transition right now, and the advocacy will strengthen up more. The role of students in terms of advocacy will be it'll strengthen up more, once we start working in the post pandemic era. And to summarize here, I feel, and to end on a positive note, what I feel is that the pandemic has given us a lot of time to think of various ideas and to think of various ways of how we can reach out to local communities. And that's what we will be working upon once we can start reaching out to local communities. And that's what we are hoping our best for, to reach out to them and talk to them and spread awareness about this. And yes, that's how we plan to build back better. Thank you so much.
Thank you, Molly. I couldn't agree with you more. I think engaging with local communities, creating awareness, advocating the right kinds of messages, etc., is absolutely fundamental. And I think young people have an advantage in trying to enter houses and talk to people, even if they're older than you. I think that's something that you can easily capitalize on. Let me pose the same question to Aishwarya Rohatgi, who's a first-year MPH student at the Institute of Public Health. So Aishwarya, what do you see as the role of your student community in building back better in the post-COVID era?
Thank you so much, sir, for the question.
Aishwarya, we can't see you quite. You have, okay. We can hear you. Yeah, go ahead. Sorry.
Sorry for the glitch. So being part of the student community, representing the youth of the nation, I vehemently believe that it is our duty as well as our responsibility to take on this challenge of building back better. After all, we belong after all, the demographic dividend for India comes maximally from our generation. So before listing out a few strategies, I would say reclaiming the environment through harm reduction measures involves both individual and collective consciousness, because it's those individual actions which pool in and translate into a collective response at a larger level. So I would start by suggesting that our schools and colleges, they need to be more environment sensitive. And as we plan to reopen, we need to revise our education systems and curriculums to lay importance on environmental science and more on solutions. To start with, I think I would say that the life cycle approach needs to be adopted, where we need to start young and lead by example in front of even the school-going children who are at an impressionable age. We need to instill that good hygiene, making environmental friendly choices at an early age is necessary, and it is in tandem with nature. It would also instill good and positive health outcomes from the beginning, as these children would eventually grow into the next generation conscious adults. After this, I think my age group, the college girls, the youth, which are the young, vibrant minds, they can bring forth innovative solutions. Since millennials and the Gen X live in the digitalization age, I think we can help them use this advancement technology to resolve post-pandemic problems, or, for example, extra biomedical and general waste that has come out of this pandemic. Or for example, the problems like climate change, or the lack of workforce and last mile delivery in services and health sector, so that we can ensure a continuum of care to COVID and non-COVID patients through smart solutions. We need to inculcate that flavor of social entrepreneurship amongst all the student community, so that they can build in self-reliance, and which would be again in tandem with the national flavor of go vocal for local. Technology will be the future, and our students need to catapult sustainable environmental friendly technology that will see the day post-pandemic era. Also, we have seen examples of Greta and many young activists around the world who have led movements to conserve the only inhabitable planet that we have. So I think we as the student community, as budding public health professionals, should judiciously use our voices for the right reasons of development, which would a development that safeguards our future, a development that prepares us to face something even worse than a pandemic like the current one. I think all of us together as a community need to talk, debate, have healthy discourses at home, with family, with friends. And I believe that the more noises we make, the more we will be heard. Another point that I wanted to focus is that we need to create a niche demand for alternative eco-friendly solutions as opposed to the conventional ones, like more demand for renewable energy, alternative sustainable eco-friendly alternatives, refurbished health systems that would be affordable, accessible, available to everyone. Going on, I think on an individual level, in tandem with the Sustainable Development Goal 12, which speaks about responsible consumption and production, we all need to comply with the already existing rules and protocols as conscious citizens. We need to start small but make those sustainable lifestyle switches. We need to support minimalism and be mindful of what we are consuming and using. And I think the 4 R's I would like to focus and reiterate on it: reduce, reuse, recycle, recover. Monitor your carbon footprint. I think one strategy that comes in mind is find a carbon scale, make the least carbon footprint option for you, which is most affordable and accessible. I think also social cohesion and community engagement comes at it has to be the focus to avert a mental health crisis amongst all us youth. So I think we can have dialogues, build secure communities to restrict the uncertainty of future and the stigmatization, which I think is which will be more virulent than the virus itself. And the social fabric hence needs to be restored with more empathy and solidarity amongst the student community. I think towards the end, I would also like to focus that we as the student community needs to be create pressure and express our concerns about the policy and governance measures. The policy instrument usually revolves around carrot, stick, and sermons, and I think we need to have cognizance of these instruments and try to raise our voices so that there is an intersectoral coordination among them. In the end, I think as we move ahead, I would say that safety, trust, community, access, wellness, and sustainability will be the mainline agenda. The pandemic is definitely the great equalizer, and my last message would be learn to unlearn, rethink your choices, coexist rather than coercively exist, and find the concepts of preventive health, community health, the balance between One Health and Planetary Health would help us drive building back better, would help us drive a healthy and green recovery in the post-pandemic era. And I would like to just end by a quote which I am personally very inspired by Reddy sir. Never before in human history have we been forewarned of a doomed destiny, but never before in human history have we so forearmed with the knowledge and tools that can alter the course of that destiny. So thank you so much.
Thank you. That was really exhilarating and very, very insightful comments from this young generation. If I were to quickly sum up what I take away from your comments, I think you'd point to 3 sets of actions. First is the importance of individual actions. I think when you're building back better, it has to start by setting an example. You have to practice what you preach. So it's easy to say, talk about sustainable consumption. It is easy to say, for doctors to advise people to change their lifestyles and start walking and start exercising and eat healthy foods. But it's also very important to be the ideal or the idol for people to look at and say, wow, this is the doctor that really practices what he or she preaches. And I think that's extremely important. And I think it's also important in that sense to break social norms that do injustice to society. For instance, there's a lot of domestic violence against women in this country and against children. The first person who comes into contact is the public health worker or the medical profession. And to be very conscious of that, you have a social obligation, and it's an individual obligation and responsibility. When you're talking about building back better, it's also about building back better societies that have a good environment and are also safe for women. The second is, I think there are a whole set of professional actions, and in any profession, medical profession or public health profession, we often talk about striking a balance between knowing, doing, and being. And I think the knowing part, I think the medical profession is very good at it. The doing part, I don't have to say, you're all operators. I shouldn't say operators. I said you all operate and really practice medical practice. And but the being part is where I think there are large gaps in the professional knowledge. And this is what I was saying, having an empathy for people, understanding better the social determinants of why people use healthcare facilities or not, the sense of discrimination and indignity that people face when coming to a hospital. I think these are extremely important for young people. And I know that you young people have really no interest in caste or religion. And so when you're at this generation, the older generation is caught and trapped in all those things. But I really hope that the being function, you evolve as really genuine professionals with a sense of being, a sense of purpose, and a commitment to society. And lastly, I just want to pick up on the first panel also, which is the importance of state actions. No amount of individual action and professional actions can result in anything unless there's a very strong state and a welfare state that's genuinely committed to serving the interests of people. We heard about the low levels of public investment. In fact, there is no country in the world that has achieved universal healthcare without the public provision of universal primary healthcare. And so we really have to look at the incentives and the well-being of frontline workers and so on, and push for the public sector in health. In fact, the COVID pandemic really tells us that if without the public sector, if we had to rely on the private sector like we all do, 70–80% of healthcare is now provided by the private sector. If without the public sector, we would have all, God knows where we would be by now. So I think these are the big messages that I take. So if you really want to build back societies, build back better societies, we have to invest in individual actions, professional actions, and push for state actions. So let me stop there. And if there are any questions, Purnima, you might want to channel them to the students.
Actually, yeah, for this panel, there's more comments than questions. Actually, there was a question, I think, to Dr. Reddy, but he's probably left us because he was called away to another meeting. Comments include building back better would be enabling community adherence towards the new normal of preventive methods. The Korean government has already announced an everyday quarantine program that is a roadmap back to normalcy after the pandemic to instill these preventive methods and behaviors of the communities. I think with the Unlock 1, Unlock 2 that is coming on, there are various opinions being shared, and I agree with some of the points raised over here that this has to be a very decentralized approach. Dr. Reddy also stressed on that. I don't know if anybody from the panel over here, either panel 1 or panel 2, wants to share some closing thoughts. We're on top of the hour over here and towards the end of the webinar session. So are there any closing remarks from anyone over here on either panel in response to any of the questions raised already in the two panels, or as closing thoughts?
Is it okay if I can go?
Yeah, go ahead, Purva.
Okay, so I just saw a comment that really struck a chord with me in terms of, I can find it again, but it kind of talked about involvement of young people in decision-making processes. And I understand that we have a multi-generational audience and also the moderation panel with the speakers. And if I had, I mean, I'm just trying to make the best use of this space that we've come together in. There's only so much change we can make as a young generation, or our older generations can make as a segment. And what I see and what disturbs me on a spiritual level is climate change has suddenly become a youth problem, or just okay, so this is what you have to be dealing with. And I don't want to sound very condescending here, but it's also important for everybody to realize that we are in this mess because somebody messed up for us. And I was in a conference a couple of months back, and it still stays with me. And this woman walked up to me, and very knowledgeable woman. She walked up to me and said, "This is what you young people should do." And I think that's something that keeps playing in my mind. And why is it that we young people have to do? When I'm happy to, on behalf of young people, say that we have so much to do, but there's only so much we can do when the decision making is not entirely in our hands. And it's a collaborative effort that we will need, and we've constantly needed in the past, but now more than ever, to come together and give young people a seat at the decision making table. Here, young people, we might not be the best generation in terms of a treasury of experience, but there is some energy, enthusiasm, and motivation that we could contribute and bring back to the table. And also, there are multiple studies that say that the Gen X cares much more about putting the society back in place, making real change and that's what they also seek in the kind of jobs they take up and the kind of professions they take up. And I think not technically Generation X, but I do resonate with that too. So it's just a call for all generations to work together and recognize that this is not a youth problem. Thank you.
Thank you so much, Purva. I think on that note, I want to once again thank Dr. Shivkumar. Thank you so much for taking the time out. I know you had to reschedule some meetings to do this. Thank you so much. It's been a pleasure having you host this. Thank you to Dr. Reddy as well. I think he had to leave us for another call. And thank you especially to all the panelists here, both from the Medical Students Association of India, all the representatives, Mauli, Purva, Salman, and who am I missing? Arpita, and all the students from the health institutes across our campuses, Aishwarya, Vishak, Sai Krishna, and who's the one I'm missing? Sorry. Jyotsna. So thank you so much. It's been such a refreshing hour and a half listening to you all, such wonderful insights, sharing with us, how this pandemic has played out in your lives, not just personal, but also academic and professional. And I mean, it's a thought that many people may not have recognized or identified. So it's nice to hear from you firsthand on how this has impacted you and your lives. And we've also heard about your thoughts on the student community strategies going forward for reclaiming planetary health, and everything from going vocal for local to eco-friendly, sustainable options. Maintain your carbon footprint, learn to unlearn, and to coexist. I think and the takeaway at the end, Purva, like to bring the youth voice to the decision table. I wish there's somebody hearing out there, a youth parliament, I think certainly in order. Maybe some of the decisions can do with perspectives from young people like you. You are the future. Excellent thought leaders that we have in the making. So thank you so much for sharing all your insights on this panel here today. I think it's a Friday evening well spent, and I hope we can have more interactions with young people like you and learn from your experiences and your perspectives. Thank you once again for all your time. And I'm sorry that we haven't been able to take too many questions. This was hour and a half, but very nice to have just heard from all of you and from the experts who moderated your discussions. Thank you so much. Have a great evening, and happy Environmental Day 2020 to all of you. Hope we will see better times soon. Thank you.
Bye-bye. Good night.
Good night.